I'd like to introduce you to our speaker, Anita Mehta. If you can give a wave, Anita, because we're not in a webinar version. Anita is the Director of Education and Knowledge Exchange at the Teresa Deller Palliative Care Residence, nurse care counselor and couple and family therapist at the Jewish General Hospital, and couple and family psychotherapist in private practice. Both of Anita's master's and doctoral studies were in the area of palliative care, and more specifically focused on the family dynamics at the end of life. Anita has worked with the Psychosocial Oncology Program at the McGill University Health Center. She's working with patients and families dealing with the illness, life transitions, family trauma, loss and grief, role changes, distress, anxiety, and depression. Anita has also worked as a consultant for the OMET's counseling department, working with children, adolescents, couples, and families. She's worked at the Jewish General Hospital as a clinical nurse specialist in medicine and oncology, and she currently works there as a nurse care counselor and couple and family therapist. Anita works as the Director of Education and Knowledge Exchange at the Teresa Deller Palliative Care Residence, and she has a private practice where she sees and supports individuals, couples, and families. Anita is accompanied today by her colleague Anitra Bostock. Anitra is the Community Development Project Manager at the Teresa Deller Palliative Care Residence. So we'll be taking questions at the end of today's lecture. If you have a question during the lecture, please use the chat button, which is located at the bottom of your screen, and I'll collect those chats and present them at the end of the lecture. Okay. Yeah, so without further ado, I'm going to give the floor to Anita.
I think Anitra is going to start us off.
I apologize.
That's okay. Oh, that's okay. I am going to just share my screen. Give me one moment.
And just to start off with, we want this to be as interactive as possible, so you don't have to wait until the end of the talk to save your questions. We have several points where we'll stop and we are hoping for discussion, so please don't hesitate to throw a comment in the comment section or raise your hand, because we want to try to be as accessible to you as possible.
So today is letting yourself feel. It's really about understanding and accepting guilt as a family caregiver. We are doing this obviously in partnership with Alzheimer's Group today, but we are also, the Montreal Institute for Palliative Care is a hub partner of the Palliative Care ECHO project with Pallium Canada. So I just wanted to let you know that. And hopefully if I can get there we go. All right, so today's outline is really about talking about caring for somebody with dementia and Alzheimer's, what those challenges and what those rewards are. The implications of guilt is, needless to say, confusing and can be very painful. Some important implications and meaning of guilt and other emotions that you may be feeling, and what to do with your guilt, and then we'll have an opportunity for some questions and discussion. So Anita, over to you.
So I wanted to start off a little bit by talking about what it means to be a caregiver. And I want to start with a personal story. I don't often do this, but recently my mother herself has been diagnosed with dementia. And so as I talk, you might see a mix of the personal and the professional. I've been talking about family caregivers for years professionally, working with them in a professional capacity, and now find myself balancing the two roles. And recently my mom had a fall, because of course she's fine and doesn't need a walker and is perfectly capable to mobilize, and was sent to the ER. And I have two sisters, one in Switzerland and one who lives in Montreal as well. And so the two of us are kind of tag teaming, although by default, most of my mom's healthcare falls to me. My sister does the books, the taxes, and pretty much that's it, in my opinion. But we got a call that she went to the ER, and then we got a call that she'd been discharged. I was sitting getting my hair done, color in my hair, got the text. First thing I feel, guilt. How can I be sitting here, getting my hair done? My mom's in the hospital, and they said I have to pick her up. I text my sister saying, hey, I can't go. My sister texts back, I'm in a board meeting. I can't go either. And so I don't know if any of you can relate to that feeling of despair, sadness, helplessness, intense guilt. And so there we both are. And it's only taken a reflective process for me to understand my sister's perspective. We're both stuck. And so there I am texting, trying to see who I can mobilize. And then she texts me back saying, I can't in good conscience let mom wait there. I'm going now. And so I'm sharing this example because there are many versions of guilt-inducing things that happen probably to every family caregiver. And I want to speak to that both personally and professionally because that's okay. We're allowed to feel guilt. And I won't just talk about guilt today. I'll talk about a range of different feelings because it's all tied to being a caregiver. For some of us, we chose to be caregivers. For others, we didn't have a choice. And along with it comes a change in our own role and our own identity, a loss of independence, a loss of our own role, a loss of the relationship we have with the person we love and who we're caring for. It can happen in any stage of your life. I'm caught with that sandwich generation, trying to raise my family and trying to manage my parents' care. And by default, there will be a change in family dynamics when you assume the role. And so I wanted to start with that story to sort of set the tone. Number one, to highlight how normal it is to feel guilt. And number two, to let you know that it's okay. What does it mean to care for someone with dementia or with Alzheimer's disease? Well, there's a lot of implications, not just for the patients, but for family members as well. In fact, there are multiple research studies that actually show that family caregivers, such as you and I, actually have higher rates and we're at greater risk of anxiety, depression, poorer quality of life than caregivers of people with other conditions. People with dementia often have other medical conditions, multiple other comorbidities that caregivers end up managing. So it's not just the Alzheimer's or the memory loss that we have to cope with, but there are other health concerns as well. So I'll bore you with some statistics before I get into the fun stuff. But what's really important here is, and I just wanted to highlight, is the fact that we're not just dealing with a person with Alzheimer's. Maybe we're doing hands-on physical care, having to change a wet diaper, having to bathe someone we love, a role we never thought we had to take on. And almost a quarter, a third and a quarter of Alzheimer's patients, this is a US study though, had a mood disorder or some other kind of long-term chronic illness. So in reality, family caregivers are not just managing the primary diagnosis of dementia and Alzheimer's, but a list of other things as well. The only thing I want you really to pay attention to on this slide is the fact that over 85% of patients with dementia and Alzheimer's disease actually had to rely on a family member, a friend, or a neighbor to help with their care. And so that's a pretty high statistic. And my guess is that's where all of you fall. You're all looking after someone. Another study has shown that over 80% of patients with Alzheimer's or dementia require help in areas such as finances, transportation, activities of daily living, maintaining their home. A lower percentage required help with actual hygiene or self-care. And when that number goes up, that's when we're faced with a decision of, do we place or institutionalize this person that we love, that we're caring for? And that's tied with a lot of guilt. So what is the role of a family caregiver? I'd like it to be interactive, and we'll get a little bit of a discussion going a little bit later. But the key piece that I want to highlight is that our role or relationship with the person we're caring for, daughter, spouse, parent, changes. Because now we may be the nurse, we may be the taxi driver, we may be the financial planner, we may be the one earning the income. All of a sudden, our role and relationship takes second place as we try to assume all these other responsibilities, and that can be very difficult for a family member. I'm curious if any of you have had to take on some of these responsibilities. Have you had to help the person you love with their medical needs? Giving medication, injections even? Have you had to help them with their toileting? Putting on a diaper, taking it off, changing bed sheets when they've been incontinent? You had to help them dress, or have they put on something or forgotten how to do buttons and all of a sudden you're rebuttoning the shirt for your mother or your father? Have you had to handle finances, legal matters, a living will? Have you had to make numerous phone calls to the CLSC or private healthcare agencies trying to get some kind of care at home so you can continue working? Have you had to organize transportation because you just couldn't take them? My guess is yes, and we're going to lead that into a discussion. So I've listed some physical tasks or things that go on a to-do list for a family caregiver. What I haven't talked about is your role as therapist. I'm a professional therapist. My guess is yours, you are not. But the emotional implications or the emotional support you might find yourself giving for the person you're caring for can be enormous. You have a concern for the patient or the person's well-being, and that can be exhausting. And that sometimes, that role of you providing emotional support to someone else can lead to the deterioration of your own mental well-being and emotional health, anxiety, depression, and of course, even caregiver burnout.
So as Anita mentioned, this is really an opportunity to have a discussion and to really, for us to understand who's around the screen and, you know, be as interactive as you're comfortable with. So I'm going to stop sharing our screen, and we just want to get to know who you are, who you're caring for, and if any of this actually what your reality is.
Does anyone want to share who they're caring for or what that's been like?
People like Claire, who just needs to unmute herself. Perfect.
Hi, Claire.
Claire, my husband Rudy was diagnosed with dementia and then Alzheimer's, I guess 2 years ago. He's doing quite well, I feel, still a little bit quite independent because he's by nature very independent, but he can no longer drive. I've noticed quite a significant loss in short-term memory in the last 6 months, gets quite confused about things. But he's not the kind of person to ever ask for much. In fact, he doesn't like being helped. So in some ways it makes my role a little bit easier because he wants to try and do as much as he can himself. He makes his own lunch, he gets his own breakfast. I have to look after the medication, but so far, you know, it's really not been that difficult. I have other family members that have much more significant issues to deal with in terms of caregiving. So I know that that's to come, but for the moment, probably the thing I feel maybe the most guilty about is my lack of patience and my sort of irritation with, you know, things that he does and his lack of understanding of things. And I have to keep telling myself he's not doing this on purpose, not doing it to annoy me. It's because he can't help it, but it's hard not to get irritated. And that's what I'm hoping the lecture will help me with.
Perfect. Is there anyone else that wants to share something? Joy?
Hi, I'm the child of a parent who is a 24/7 caregiver for my dad. And I guess my guilt stems from the fact that my dad's had quite a decline in his cognition in the last 16 months. And guilty that I really couldn't be there and provide the stimulation that he so desperately needs. And I don't know if he'll ever be able to rejoin an AGI group event again.
Thank you, Joy. Does anyone else want to share? No?
I can, yes, I would.
Sally?
We've got
Yes,
Sally,
that's
and then we
right.
have Jessica after that.
Okay, so my husband, also called Rudy, was diagnosed with Alzheimer's about 3 years ago. And unfortunately, he had a stroke afterwards, and life became very, very difficult. Only 5 weeks ago, I placed him in a residence, which is an absolutely amazing place. They take wonderful care of him, but I feel tremendous guilt of having had to do it.
Thank you for sharing, Sally, and we'll address that. Jessica?
You're on mute.
Yeah,
There
sorry.
you go.
I've been caring for my mom for a number of years, but she is undiagnosed. A lot of the difficulty I guess I'm having is reaching out to everybody in the community, trying to get her the help she needs. She's independent, living alone, and doesn't believe that she's declining, but there's many days that she doesn't think she's in her own house and thinks we've moved her. And, you know, there's obviously a huge decline going on. So we have managed to get some CLSC help and services, but it never seems to be enough. But she's a difficult personality in that it's not enough for her, and it's emotional support that she needs more than anything. And I'm not able to give her as much as she needs. You know, I think she could use 24/7, somebody there all the time with her, but she would not consider ever moving into a residence or doing anything else. So we do what we can on a daily basis, but with the continual feeling that it's never enough.
How many feel guilty for feeling guilty? I'm not seeing any hands, so yeah. Okay. Me too.
We had Linda, I think, who wanted to say something.
Sorry, Linda. I don't.
Yeah, my husband was diagnosed with certainly vascular dementia and possibly Alzheimer's, so mixed dementia about 4 years ago, and has just recently undergone a functional assessment for driving and has lost his driver's license. So that has produced a great deal of confusion and pain for him. He is of the 50% of dementia, people with dementia who do have insight. So that helps in that he's aware of his cognitive deficits, but he doesn't see the connection between that and driving. So that's a struggle that we're ongoing. And I've also seen a decline, I would say, at least over the last 16 months, if not longer. And I guess my guilt has more to do with feeling like whatever stimulation I can offer, and AGI has been a godsend throughout the whole COVID misery. I still feel as though it was never enough. So not enough seems to be a theme, you know. Yeah, that's it.
Thank you, Linda. Is there anyone else?
With Karen.
Hi. Oh, Sandra.
Oh,
Sandra?
Sandy, and then Karen. Perfect.
Yes, my problem is that I'm dealing with my mother, and the guilt I feel is that I know the person she was and now dealing with the person that she is now. It's two different things, and it's very difficult for me because I'm used to that happy person, and now every minute it changes. So that is very difficult for me to deal with. And I feel very guilty that I'm placing her like in a box, and she doesn't like that either. So it's tough.
Thank you, Sandy. Karen?
Hi, my dad is in Montreal. I'm in Vancouver, and my guilt comes from the fact that COVID has been kind of helpful because I had the excuse not to go visit, and I feel guilty about that. But I am visiting in September and having a lot of anxiety about it. I knew I'd be the first to cry, hopefully the only one.
Not the only one.
It's a safe space, don't worry.
Okay, I make people cry for a living, so my hope is that you feel during this talk and that you're comfortable accepting what you're feeling and throwing it out here if you want. As Anitra said, this is a safe space. And you'll get my email at the end. If someone wants to reach out to me, I'm more than happy to answer your questions or try to offer my support in whatever way or problem solve with you. That's not a problem. So I can offer that at the end of the session as well. I think, Sandy, you mentioned something that's really important, and that's that sometimes it's hard to recognize the person that we're caring for because there's so many changes that happen. And the key piece, and I always tell family members that I work with, is try not to take it personally. And that sounds so easy to say, but when you're in the moment and this is the person that you love, that you're trying to care for, it hurts. And so that hurt can sometimes turn into anger. And that anger sometimes turns into resentment. And that's a pretty powerful feeling because then you feel guilty for feeling that anger. And how could you possibly feel guilty? How could you possibly feel angry? Because it's your duty and you're supposed to take care of this person. And then you spiral. And so I guess what I can offer here is to say that's very normal. And I don't mean to speak for all of you, but I'm making an educated guess that that might resonate with some of you. And even though I say not to take personally, maybe we can look at, if we have time at the end, some strategies on trying to separate yourself from that personal feeling. But I can share another story as well. As I said, my mom has been recently diagnosed, or we're working toward a diagnosis. And gait, changes in gait, as you must all know, or mobilization is sometimes something that happens with patients who have Alzheimer's or changes in cognition. So she falls a lot. And she fell once while I was with her, and kind of teetered over and fell. And as I rushed over to pick her up, she said, "Stay away from me. You're hurting me. You're always here to hurt me." And I said, "No, I just want to help you up." And she says, "Get away." And then she says, "You're a horrible daughter and you're a horrible nurse." Ouch, right? I have a pretty good self-esteem. I know who I am professionally and personally, but that hurt like hell. What hurt even more is when she called all the family members to say that I pushed her. And then it changed to I kicked her. And so you can imagine that drive home where I'm sobbing all the way home, giving these wonderful talks on how to not take things personally and how to be a caregiver, but feeling hurt and guilt and sadness. And yeah, a little bit of anger. And so I had to remind myself that it was okay. And that's what I want to let all of you know. You have every right to feel what you feel. If anyone tells you otherwise or says you shouldn't feel that way, it's okay. They're wrong. I would challenge them. The question is, when you feel that, what do you do with it? Where do you put it? And that's what we want to talk about today. So if it's okay with you, we'll pull up our slide. Oh, sorry, Jean. I see.
All I just want to say, my husband is, it's 98% sure that he has frontal temporal behavioral dementia, and we're waiting for a final test, but we're just, I've been reading a lot, taking lectures. To me, it's so evident because his behavior is so different. And memory is fairly intact, but he is not as focused. So like he'll get out of the car and he'll leave the car door open, and, or he'll leave the door, he's going into the garage, and normally he would shut the inside door right away, and, things like that, which I don't think it's memory as much as he's so focused on the task. And so that's that he just forgets. But he is very he has no tolerance, he's so impatient and quite agitated. When he's watching TV or reading or doing something that he likes, playing with the grandkids, he's okay. But if he's in an agitated mood, it's Jean, where does this go? Jean, I can't get the TV on. Jean, and it says my name a million times. At first, I thought it was just me, and you start to feel that, oh my God, this man doesn't love you anymore. And then I realized as I see him doing it more and more with everyone, even his youngest daughter, who he loves to death. And, you know, if he or anybody that we have in the house to, you know, to sort of like as a companion, we play games or do something. If something bugs him, he'll yell, doesn't matter. So he's lost that filter. So it's really hard watching, but often I'm angry and I'm guilty that I'm angry. And sometimes like I should just ignore his behavior, but I point it out and it's just like a revolving door. And the guilt is there. And the kids want me to do as much as I can on my own while he still can. So just an example, this weekend, finally I got all my shots and I went and babysat for my 2 grandkids who are 10 and 8, and I slept there. But when my husband got wind that I was going, he said, "Oh, I'm coming too." And so anyway, finally, and my kids and my daughter-in-law said, "Oh, we were hoping you'd have a little bit of respite." And you know, I was feeling such guilt. And finally I said to my husband, "You know, he can still be on his own." So I just got supper out ready. He just had to microwave it. I said, "It'd be kind of nice maybe if we get some space." So that's what I did. But the guilt I felt, and then I think, oh my God, I do so much for him, but I still have that guilt that he should have come, you know. So, but it was the best thing I could do, because it would have been the third child to, you know, if he was agitated or if he was impatient, the grandkids would see it, and then I wouldn't have, my energies would have put more on him than on my 2 grandkids. So that's it.
Thank you, Jane. If you can pull up the slideshow, Anitra. One thing that I find helpful when working with family members is this concept, intent to hurt. And when working with patients with neurocognitive deterioration or changes, the key question to ask yourself, the moment you feel, and our bodies tell us first, when we're feeling anxious or agitated or guilty, something happens. And it's different for every person. It could be an increased heart rate, it could be getting sweaty, it could be nausea, some have diarrhea, but your body tells you that you're not okay. In those moments, it's helpful to ask, what's their intent? This hurt that I'm feeling, did the person I love mean to call me whatever he called me? Did she mean to say that I pushed her? Probably not. And that's the distinction, because we translate the current behavior through the lens of how we saw the person before. And that's where the distress comes from. How could my mother do this to me? How could she say I kicked her? But that's a different version of my mother. And was her intent to hurt me? Absolutely not. Was her intent to protect herself because there's shame involved in falling? Most likely. Was that behavior or what she said a result of all the changes that she has no control over? Absolutely. And even though it sounds like a very obvious process to do, we don't do that. We jump right to reaction. And so what I'm saying is slow down. When you're in that moment where you're feeling what you're all sharing with me that you're feeling, slow down. Recognize what you're feeling physically, cognitively. Ask yourself, where is that coming from? And always look at intent to hurt, because most of the people we're caring for don't have that intent, but we feel it. And that's where our feelings come from. And so I just want to share that with you, because I think that's an important strategy or intervention. I wanted to focus, since we're talking about the hard stuff, on some of the good stuff. And what are some of the rewards of caregiving? Because believe me, there are plenty. And research has shown, and in personal interactions, I've heard this several times, that there's a sense of giving back to someone who has cared for us. And therefore, there is a reward in giving back. People have reported personal growth, satisfaction in knowing that the person they love is receiving good care. Some have reported that there's increased meaning or satisfaction or purpose in their life when they're caring after somebody. And so there's also a sense of satisfaction, even after research has shown caregiving has ended, because of that degree of implication. On the other hand, what we're talking a lot about today are the challenges. And I don't want to spend too much time on this, because I think that we have covered it, and you will all receive a copy of the slides, but I think I've heard different versions of this from everybody. But, feeling tired, fatigued, challenges sleeping, neglecting your responsibilities because you have too many of them, so you have to prioritize, and something's got to give. Cutting back on pleasure, and so going somewhere, who had mentioned that earlier, was it Jean, without the patient. Yes, there's guilt involved, but that's so important in terms of taking care of yourself. And we do a whole lecture on self-care, and we won't be able to do that here, but that's an important part of caregiving as well. I often say to patients that we don't need two people in a hospital bed. And so in order to take care of your loved one, you need to take care of yourself. So here's something interesting. Can we feel both at the same time? Does it have to be all difficult and all distress and all worry? Does it have to be only joy and excitement and happiness in the role? Absolutely not. Actually, many caregivers actually experience positive experiences and some strain simultaneously at the same time. And so that emotional distress can coexist with the psychological satisfaction and growth that you're getting from caregiving. And I think this is another important piece, to recognize that in the experience that you're in, that there are positives that can coexist with the distress that you're feeling. And sometimes we forget to stop and to reflect on those. So actually, I think we've covered this, Anitra, if you agree with me. I had wanted to ask, what were your feelings? But I think you've shared with me, I've heard hurt, I've heard anger, I've heard sadness, and of course I've heard guilt. So I think unless someone else wants to jump in and share something that I haven't covered, I think we can go to the next slide. Is that okay? Oh, Joy?
Frustration. Oh, I see it. It's on your screen. Yes.
That's okay. You can say it as well. Frustration. Yeah. Is that tied to changes in behavior that you're seeing, or the feeling that you can never do enough?
I guess it's more tied to feeling that my mom isn't doing enough to help my dad.
Okay. And that's another common theme. Where's my help? Where's my support? There's 3 of us. We're 3 sisters. Why am I the only one going to all the doctor's appointments? Why is she calling me first? And so it's not uncommon actually to have a lot of family conflict or shift in family dynamics around this, and that can lead to a lot of distress as well.
I just like to add impatience. I find I'm very impatient. I'm feeling I should be more patient with things.
And I'll add, my mother, who lives with my father with Alzheimer's, she says she feels disloyal. She feels disloyal, so I should add to that, for reaching out and getting support, for talking about his challenges with me or with Megan and I at AGI.
Because she should be able to do it all. That's her duty. Why on earth would she need help? Okay, so a lot of this is going to be addressed when we look at interventions and feelings. And here we are looking at interventions and feelings. So the key thing, there's a particular therapy called acceptance and commitment therapy. And what that looks at is accepting your feelings. A lot of times I've had family members come to me or other therapists speak with me and talk about helping resolve the guilt. I'm trying to work on this person so they don't feel guilty anymore. Really working on the fact that they shouldn't be angry. And I kind of take a different perspective, because that's not the goal, because you're allowed to feel what you feel. And so accept them, accept that you feel guilty, accept that you feel angry, accept that you feel disloyal. But then the next step is understand why. Why are you feeling all these things? Where is that coming from? And then how do you get the help, or where do you put it? And so I'm taking a little bit of a different approach to it. Because at the end of the day, I wish I could tell you that you won't feel sad anymore. Or that at the end of his talk, that guilt's going to disappear. Then I'd be a pretty crappy therapist and lecturer if I told you that. And so the first piece is accept your feelings, recognize them, and they're okay. Things like anxiety and worry, You may worry about how you'll handle additional responsibilities of caregiving. What happens to the person that you love if something happens to you? You may also fear that what will happen in the future as there's a deterioration. And so the key piece there is what happens to that family member if something happens to you? And that's why the detachment or the taking care of yourself is so important. Because the truth is, there are high incidents of caregiver burden. And that anxiety, that depression, that burnout actually can be quite crippling for family members. And I don't know where each of you are on that trajectory, but we're going to talk about checking in a little bit and paying attention, because actually the best care you can give the person you love is caring for yourself. Anger or resentment. You can feel angry or resentment toward the person that you're caring for, even though you know it's irrational. And somebody touched on that. You might be angry at the world in general, and you may be resentful for other family members. Someone else mentioned that, who don't have your responsibility. And again, normal, and accept those feelings. And we'll talk about what to do with them shortly. Guilt. You may feel guilty for not doing more. You may feel you could be a better caregiver, you're not doing enough. Someone mentioned impatience. Was that you, Claire, that you just feel impatient all the time? And where's Karen? There she is. Long distance caregiving, not being able to be available. And while there's a relief in COVID saying, oh, that's my cover, I just can't be there, there's guilt involved because I feel I should be. And grief. This one is particularly important because I don't think many caregivers realize that they're grieving. And as a bereavement therapist, I want to highlight that this is a fundamental feeling because it's tied to loss. From the moment there's a diagnosis of a neurocognitive change or deterioration, the person you love, their personality changes. The relationship you have with them changes. The role they had in your life and you had in theirs changes. Things you could do with them changes. So it's tied to loss. You are losing so much of who that person was and what you could do with that person and how you interacted with that person. And when there's a loss, by default, there is grief. And so I would almost argue that all of you, myself included, we are grieving. We are sad. And this is something that caregivers don't often recognize. So I really want to highlight this, that we should recognize that we are in a grieving process. There doesn't have to be a finality or a death for us to grieve. It's often from the point of diagnosis, because that's where the loss starts. And so we're grieving, and we need to recognize that. So here's a slide that is very striking when we talk about guilt. We know that guilt can be overwhelming. We're talking about it today because it needs to be acknowledged and it needs to be addressed. It requires an open and honest discussion, which I'm hoping we're having today or we can have. And it's key that we balance expectations of rewards as we go in saying we're going to care for this person with the expected challenges. But if you look at this graph and you look at that 22%, the light gray, how often do adult caregivers feel guilty? Multiple times a day. That's a lot of feeling guilty, isn't it? Does that resonate for some of you? Next slide. So what can you do? Check in. Ask yourself how you're feeling. Do any of you actually do this? Do I have some family caregivers that are amazing at this and ask themselves how they're doing to make sure they're doing okay? No one's hands jumping up? No? Are there caregivers who, at the end of the day, review all the great things they've done for their loved one? No. Do I have caregivers who, at the end of the day, recognize all the things they should have done or could have done better? Yeah. Okay, so let's flip that around. So there is a strategy used that works for some and not for others, and we don't have to call it gratefulness journaling, but the check-in is really important. Check in how you're feeling. And that's tied to check in what you've actually done. It's amazing how black and white family members can be. I never do enough. I always fall short. But there's a whole gray zone between always and never that we forget. That's where we actually live, and that's where we actually function. It's a very helpful strategy for caregivers, and research has actually shown that it decreases distress and anxiety if you stop for a minute. I recommend the end of the day or when you're feeling a little bit worried or anxious. You don't have to even write it down. You can talk to yourself, not on a bus with other people witnessing, but talking to yourself is okay. Tell yourself, remind yourself what you've done well for the person that you're caring for. She called 5 times. I picked it up 3 out of 5. Not bad. I didn't have to do that. I took her to her doctor's appointment. Didn't have to do that. So remind yourself of all that you do instead of making the list of all the things you didn't or you feel you didn't do well enough. Because many family members don't stop to do that. And tied to that intervention is also feeling grateful. I feel grateful that I still have my mom. I feel grateful that I can share the responsibility with my sister. I feel grateful that I found that residence or that nursing home that can take care of the person I love, versus guilt. I feel guilty that I was the one supposed to look after that person. And how could I have possibly put them in an institution? To flip it around and look at it from the gratitude perspective. How grateful I am that I finally found resources to look after my mother, my whoever that person is. Does that make sense? Any questions? It's so hard to look at everyone's. Yeah. Okay. Okay. How do we manage guilt? So I think we're pretty good on the first one. Recognize the feeling of guilt. I think most of us are able to say, I feel guilt. But hang on, we need to be a little bit careful. Sometimes it comes out a little bit differently. It comes out as irritability. It comes out as us being maybe a little bit impatient. It comes out as us maybe forgetting things. And so, because we feel guilty about feeling guilty, so we don't want to feel it. Because feeling guilty is attached to us not being good enough or not doing enough. And so some family members can't recognize the actual feeling of guilt or want to put the label on it, and that's okay. But pay attention to other behaviors. And actually there's an overlap with symptoms of depression and manifestations of guilt. So changes in mood, irritability, decrease in motivation, sleeping poorly, lack of pleasure in doing things that used to give you pleasure before. If any of this sounds familiar, that's actually the depression checklist. If you're checking off a lot of those, then it might be time to take a step back and look at what's going on. But that's part of recognizing feeling guilt. It may come out as something different. Be compassionate with yourself. Accept that you can feel guilty. Tell yourself it's okay. Tell others it's okay. If they're other family members or your siblings or your parent who's looking after someone, it's okay. How can I help? Look for the cause of the guilt. And that's where I said, stop and take a moment. Understand where the feeling is coming from. What are you feeling guilty about? Take action. So if you can identify what you're feeling guilty about, then you can take a step back. And sometimes it's hard to do by yourself, or sometimes you might need to brainstorm with someone else, but to look at what can actually be done. If I'm feeling guilty because I'm not going in enough for my mom, can I rationalize it and recognize that I work full time? Can I have a conversation with my sister and say, maybe we should tag team on this? Can I, if I have the financial means, send in a sitter? Can I ask the family doctor for a CLSU referral to get some help in? These are all interventions that can only happen if I take a moment to say, here's why I'm feeling guilty. I'm not doing enough. Then you go through the gratitude or that list of what I am actually doing, and you'll see it might be pretty long. And then how do I supplement it? That's the take action piece. Okay, we can flip the slide. The other thing I wanted to talk about is how we make meaning of the experience that we're having. And meaning making is a really important concept, and we use it a lot in cancer patients. But I think it's applicable across the board to anyone going through a caregiving experience. And that's what I sort of touched on, how you define your experience. And it's usually burden versus the experience being very nurturing and very gratifying. I'm not saying it can't feel like a burden, because it can, and it may be. But again, it's tied to the reframing or the looking at it a little bit differently. When family members actually search for and find meaning in that caregiving experience, they can actually experience positive psychological states, even during very stressful circumstances. The exacerbations can sometimes be seen as blessings. What can be helpful is sharing of stories. And that's why I'm a big believer when I do these talks in having people share their story or their narrative and having others listen, because sometimes it can be very isolating. And it's hard to understand what the experience is. And then you look across and you look at all these faces on the screen and everyone's saying, oh my God, I feel guilty too. I find this really hard too. You can switch slides. These are some statements that family members have made, and I wanted to read them out because I think they're important and they may resonate. Yes, I think caregiving gives me meaning. I'm not always able to change the outcome, but caregiving is showing someone you are with them in the trenches. The key piece there is you may not be able to change the outcome. Knowing that mom can count on me for the best care, yes. Sometimes it's frustrating and exhausting, but she's so amazingly grateful. So the love on both sides outweighs the bad days. My life is immensely meaningful because my husband is disabled. Without my care, he'd be in a nursing home. So we are very blessed. And again, you can have these feelings and at the same time find your experience very difficult. But it's important to take a moment to understand what the caregiving experience actually means for you. Because if you can find meaning, then it helps. So if you're open to it, I wanted to throw that question out to you and ask you, what does being a family member or family caregiver of someone with Alzheimer's dementia mean to you? Have you gone through the process of trying to assign meaning? Is this the first time you've heard this concept or this idea? No takers? Jean, are you waving?
Yep.
Go ahead.
I don't know if this is fine meeting. I mean, I'm not that good at it because I'm impatient sometimes. I can be impatient and I have to take breaks away. And but I do feel good about that I'm able to do things that I didn't do before, because my husband was always very helpful and he always drove. That's number one. He's a kind of a backseat driver, so I was quite happy to. And I prefer to just, we had long trips to Toronto when my son, before he came back to Montreal. And so I was quite happy, and he was the driver. And now I'm driving because he hasn't had a test or anything, but the doctor said until we get his meds in place that he shouldn't drive, and he's not fighting it, which is amazing. I think he does feel anxiety driving, and so he's taken to me driving, but I am driving everywhere. So I live in the West Island, and you get complacent. All my doctors, everybody's out here, so I don't go downtown. And if we did, my husband drove. So now I'm finding myself driving downtown, and so that's one thing. I always was involved with finances, so that's not such a big deal. But there are other things, like he took care of sending everything to our insurance plan, and now I'm doing that. And he did some of the cooking, and now he's just cleaning up when so I'm kind of looking at that part for me, that I'm resilient in that way. But I still haven't got the anger and like some of the things you said, thinking ahead, what's it going to be like, and am I going to be able to do it? So I don't know if that's what you meant.
Yes. That's
It
exactly
is.
what it is. And they can coexist. So you found meaning in that you've become more autonomous, more
Right.
resilient. And so
Right.
it's been a redefinition of who you are.
Right.
Of course, that can coexist with the sadness and with the anger, because uncertainty is hard to manage. The only thing you're certain of is that there will be a deterioration. What
Yes.
you don't know is what it will
Right.
look like. And you
I
can probably, sorry, Jean, go ahead.
I didn't hear you, sorry.
Oh, I don't know how far, but I said that the only thing you can be certain about is that there will be a deterioration.
Yes, that I
What
heard.
you can't be certain about is what that will look like. But I do think you can also not be certain about, but anticipate what the implications will be on you. That you might need more care, that you might have to activate more resources, that you may have to look at placements, that maybe you need to change your work hours depending on your situation. So when family members say, I have no idea what this is going to look like, I always say, let's stop. Let's take a look at what this might look like. Because anxiety is often tied to, in fact, most of the time is about lack of control. And so we often work through what we can control. And then we look at what pieces we can work on. And sometimes that's an incredibly helpful intervention, but it's such a global concept, uncertainty. And we often say, I have no idea what's coming. I don't know if I'll be able to deal with this. And so I say, just slow down a second. What do you think? What can you imagine might happen, or what's down the road? Because the trajectory is actually pretty defined when you look at chronic illness such as Alzheimer's or dementia. So we can look at that and then look at what the coping might be. The other pieces, I think you talked about impatience, and sometimes having to repeat things, or someone not knowing what something is, or someone telling you that you're wrong. And it may sound a little bit silly, but repeat it with a smile. And that changes things, because what happens is we feel irritated. Someone's asking us the same damn question, and I just told you 5 times and answered that. And we're getting irritated. And I go back to intent. There's no control over the re-questioning or the repeating of the behavior. And so if you can take a step back and try it, I'm not kidding, and just say, I just told you, right behind it. Actually, don't say I just told you. Just repeat the answer, because the I just told you underlines the fact that they can't recall and remember. And depending on where they are on the trajectory, that can itself be a trigger. Try saying it again with a smile. It gets a little easier. But if your facial expression changes, so will what you feel inside. And I go right back to intent, right? They can't control the behavior, but you can control how you respond. Does that help?
Mm-hmm.
Anyone else want to share something related to meaning, or how they've kind of interpreted or looked at their caregiving
If
experience?
Claire would like to say something.
I was just going to comment that really hit home when you were saying just step back, take a moment, and when you talk about things that you maybe feel good about your caregiving, I feel pretty good about the way I'm managing, and often I'll tell myself, don't feel guilty, Claire, because you are doing such a good job of looking after all the business that you never had to do before. You're making really great meals for him every night. You're making sure he's going for his walks and having a nice time. Like, I'm doing a lot and managing, and it doesn't bother me that I have to take on all this extra responsibility and stuff. What I feel guilty about is that emotionally, I'm not giving him the support or understanding that I should be. And I guess what I feel I'm grieving a lot is the lack of companionship that we have now. It's so sort of boring and deadly, because the conversation can never be anything much more interesting than, a few things about the grandchildren, or what's the weather like outside. So we sit at the dinner table and there's nothing to say other than talk about the grandkids or some just, sort of boring thing. And I find I feel guilty because I'm frustrated that I don't have a more interesting partner anymore. And I do also worry a lot about the future, because I have family members that have gone through very, very severe situations, and I know that this is to come, and I just don't think I'll be able to be the kind of emotional support if things get tough like that. I can manage all of the, what I call the easy stuff, like all of the caring for all the business and taking all the meals and doing all the groceries and taking him to appointments and all those things, but I don't really have confidence that when the going gets real rough later on, that I'll be able to handle it, because I don't feel that I have that capacity. So,
Sarah, what kind of emotional support do you think you should be giving?
just to be more loving, you know, I find that hard.
What does that look like?
You know, I should just be smiling more, which is a very good idea to do that. And lately, up until, like, we actually got away last weekend with our grandkids for the first time since COVID, and we went to the Eastern Townships. We had a fabulous, and it did me so much good, all of us. And up until then, I was just feeling like literally from the moment we woke up to the end of the day, it was just like one argument after another, just me correcting this or, you know, insisting on that, or him asking me yet again for the 10th time the same thing. And I was just so, you know, just so at the end of my rope with my patience. And then I realized, you know, you've got to just let those unimportant things go. You know, so he, you know, I don't know, I can't even tell you all the most irritating things he does, like thinks sun's gonna fade our rugs now all of a sudden. So he's putting towels and pillows all over the house and pulling down blinds. I tell him 10 times that we have special windows that don't let UV in. And then I said, what does it matter if he does that? Like, just pick them up afterwards and stop getting annoyed and irritated over those unimportant things. So it's a constant conversation in my head with sort of giving myself a talking to. And sometimes I'm okay with it.
That's the exact right intervention. The challenging of the behavior, the pointing out that the behavior doesn't make sense, doesn't work, because it's completely rational in their mind. And you can't change that. Yeah. And that's the acceptance piece that I talked about earlier. The other thing I wanted to respond to is emotional support. And it's amazing how caregivers underestimate the amount of emotional support they're actually giving. Emotional support isn't defined by a great dinner conversation. Maybe it's the preparation of that meal, or making his favorite dish, or going over talking about the grandchildren for the 15th time, because that's what does it for him. Maybe it's watching TV just sitting next to him, or putting your head on his shoulder, or holding his hand. There's so many different things that caregivers do on a daily basis that you don't recognize as emotional support. My guess is, Claire, you're doing it. Is there somebody else who wanted to talk about meaning? Anitra, are you seeing anybody? No? I love this quote. The capacity to care is the thing that gives life its deepest significance and meaning. And so really connecting with your loved one is how I would define emotional support. And so taking the time to just be present is huge, and it's an underestimated intervention. So what are some of our expectations? Sometimes we don't ground them in reality, and we forget to say these things to ourselves. I can always ask for help. I can always get help if I can't manage. Caregivers sometimes say, this is what's expected to me, so I have no choice. That's my favorite one, when I meet a family member who says, I just don't have a choice. Because of course you do. You just don't see what they are just yet. I really don't know what to expect. And again, we just touched on this. I slow it down and I say, yeah, you know what? We kind of can make a list of what you can expect. And so it becomes more tangible, more real, more in control. Because we have these expectations of ourselves that don't necessarily match the reality of the situation. So this is really key. We talked about finding meaning, and I asked some of you if you had found meaning and asked you to share. Maybe some of you haven't, or you haven't even thought about the concept. And maybe it's very difficult, that your situation is so challenging that you don't know what this means. What does it mean when you can't find meaning? It's important to realize that you can still love and you can still care, but you don't always have to take care. And this is where caregivers sometimes get confused. The taking care or the hands-on management of the person you love translates into this is the proof that I love this person. And if I stop doing it, I'm not caring. I don't love the person. And so I want to really highlight that you can still love that person. You can still care so deeply about them, but maybe you can't take care of them, and that's okay. If you start to realize that you're questioning your motivations and your capabilities of being a family caregiver, that's a red flag. It's okay to need help or support or to talk it over with someone. That doesn't mean you're not a good caregiver. That actually means you're a really good one because you're recognizing your limitations. If you say no, what does that mean? If you say, I can't handle it anymore, I can't be a family caregiver, I can't do this. What it might mean, I'm tired, I'm feeling a bit trapped. And those are hard words to say. And it comes out in behaviors. It comes out as fatigue, it comes out as irritability, it comes out as guilt. But maybe you're feeling tired and trapped. You might interpret as I have failed to be all I could be as a caregiver. If I say no, I can't look after her at home. If I say no, I can't take her to all her appointments. That means I failed as a family caregiver. If I can't do what you tell me to do, if I can't follow the doctor's directives or follow the instructions the CLSE nurse left for me, I feel inadequate. I feel so tired, I have to stop. That's what saying no can mean. When you say no, it might mean you just can't. You can say no and then say yes again. So it can be understood as a pause, a time for reflection, a breathing period. Saying no might mean let's stop, think it over, talk it over, but something needs to change. If I'm saying no, it's not because I stopped caring and I stopped loving. It's because I just can't. But what I really want you to leave today with is that it never, ever means I have failed or I don't love you. And unfortunately, this is how we translate it. When we say no, this is what we think it means. I have failed and I don't love you. I wanted to end on that note because I think that's a very powerful message. And it's one that I want to leave you with. And I deliberately always leave time for discussion if you're wondering why it's only 1 o'clock, because I do want to open it up and give you the opportunity now to provide me feedback with what you've heard, challenge me on things, ask me questions. So this is, please use this as your time to have a discussion. Any questions or comments? Sam, if you can unmute.
I just want to say thank you to each and every one of you for what you're doing. I've lived through a lot of the things you're talking about, and you're great. You're really fantastic. It's we need a lot of love in our world, and you guys are doing your best to give it in whatever way you are. So thank you, everybody, and thank you also to the people who've organized this, because obviously you're trying to do something really good and probably succeeding. So thank you, everybody.
Thank you for your feedback, Sam. It's always nice to hear.
Jean?
Okay, so some things I am better at in terms of the patients, like what my husband will say, well, should I go for a walk now? Or could I don't know, well, walk comes to my mind, or should I wear a mask? And all questions I knows the answers. Sometimes it works just to kind of not answer. But at the beginning, I was having a hard time. And a couple of times I said, I feel like I'm your mother. And I mean, that's the wrong thing to say. And I knew it. And now I say, what do you want to do? And that works perfectly. And so I've mastered that. But what I haven't mastered is his frustration. He's frustrated very easily. So example, we're going down to he's in a setting now for brain stimulation, and I have to take him for 2 weeks every day, and this is every 2 months for a year. Okay, so a simple thing, like I said, oh, Gord, check the weather, and he has his phone on him, and the phone is in his pocket, and oh God, so he starts really, really loud. I can't get it out. I can't get it out. And then I'm sorry. Oh God, I'll never ask him to do that again. So I'm learning from my mistakes. But, we're getting gas, for instance, and we're at the pump, and, I don't want to take everything away from him. And, and so he's saying, hurry up, and he's loud. Like when he yells or he's frustrated, where do I put this in the cupboard? I can't find where to put it. There's too much stuff in here. That's where I have a hard time. What do I do with the yelling? Aside from anybody we see personally, they know that he has a problem. But the yelling part, no matter how many times I've told people, it's embarrassing and it's uncontrollable. He has a hard time. He doesn't even realize he's doing it. And I find it really difficult. Is there some way I could make him, I don't know, stop, not completely, or what do I do? Oftentimes, if it's just me and him, I'll walk away and I'll say, okay, I'm not helping you with the controller until you stop the screaming. Sometimes it does work, but it involves a lot of patience. I say, I'm not helping you, and like sometimes it's perfect with the controller, and then another day he isn't. But he's yelling and he's pressing, and he's not, reading what's on the screen, and if he just calmed down, he could do it, but it's hard calming him down. Do you have any advice for that?
Okay, so let's take it one step back. In the same way I asked you to recognize why the feeling. So what's he feeling?
Sorry?
What's he feeling? What do you suspect he's feeling?
Frustration, impatience. He's very impatient.
Helplessness,
Oh,
lack of control, sadness.
Yeah, a lot, I guess. Yeah, but he doesn't give it a second, not a second. Like,
Because
the other day I caught him on the waiting for his toast, and his hands are like this over the toaster. Come on. And I'm thinking, oh my God, the toaster is programmed. You can't, the only thing you can do is make it lighter, and his hands are over the toaster. Everything has to snap in, and so like I'm very conscious of things now that are going to make him do that, and I hate it when he's like that. So something as simple as the mayonnaise is always in the same place, right where he can see it, and he doesn't have to go behind the jars. So I'm always trying to be one step ahead, but sometimes you don't know when it's going to happen.
Right.
So helplessness, you say, okay.
But also you don't know what's coming up, neither does he. And so again, depending on where, what kind of dementia or where in the brain, it's
right. Frontal temporal is where.
So impulsivity, decision making, and problem solving.
Yeah.
Frontal lobe.
Right.
So he's not going to be able to curtail impatience ever. Right. And so that's the key concept. And yes, it's frustrating. But if your expectation is, my God, I showed you 3 times, I don't get it. But if you just stopped and looked at the TV, you would see it.
Yeah. Oh, I've done that.
I know, but Jean, you know what? He just can't. And that's a function, again, not of malintent, or not of because he really likes to get under your skin and it's fun to piss you off. No, he just can't. It's a function of where, if you're telling me frontal lobe, I can tell you right now that that's problem solving, impulsivity, decision making, right there. And he doesn't have the control. And again, if you can't control that, what can you control? That deep breath. And when that hand's over the toaster, that kind of going, here we go again, instead of the here we go again. Very different. how you internalize or recognize that behavior. You know, I could even talk a little bit about CBT, or our behaviors are shaped by our feelings, which are shaped by our thoughts. So if your thought is, oh my God, he's so annoying, your feeling is frustration and anger, and your behavior is yelling. If your thought is, my poor husband, he has no control over this, I feel really, then your feeling is, I feel really sad or distressed about this. And your behavior might be a hand on his shoulder and just say, it's coming out. It'll be a few more minutes. Does that help? And again, I wish I had more time. I could do a whole thing on cognitive behavioral therapy and just how to change your behavior based on how you think and how you feel. But it's all tied to what I said, that you take that step back and you take that deep breath and you just recognize you can't change his behavior. Sometimes you can, depending again on the dementia and what kind of treatments are involved. So I don't want to say that it's a hard no, but most of the time it's a function of the illness, a function of the disease, and very much out of their control. They're not trying to hurt you or make you annoyed. They simply can't. And imagine, for those who have that insight, someone had talked about how frustrating, how sad that must be. And so as you're feeling what you're feeling, they're feeling what they're feeling.
Jean, I'll give you a hard no. He can't become patient.
Karen.
Anita didn't want to give you the hard no, but I'm going to give you the hard no. He's not going to develop patience. He has a disease that makes him impatient.
Yeah, yeah. That's a good way to state it. He has a disease that makes him impatient, except he was a little bit like that before the disease.
Impatient. I know, but so if he was
but never like this
before he had brain trauma, it's certainly not going to get better now, right?
Yeah. Oh God, yes. But yeah, and you don't want to hide in a corner. You want to be with people, socially he needs to be socially active. Everything I've read about, everything I take. But then if you're going to be embarrassed,
right.
do that. Obviously,
some people actually will carry a little card and hand it to people and say, yeah, my husband has a disease that makes him impatient.
Yes. Well, that's funny because we were going for supports for our shoes and I knew he might be anxious and I had it ready in my purse just to give it to him. But he ended up being not too bad. So I just didn't do it. And you're always thinking about I feel bad for him,
right, but when you let somebody else know what's going on, then if they can't be empathetic, then that's their problem and not your thing to be embarrassed about, right?
Some people can't, like his own brother doesn't even bother calling. He lives in Toronto and he just he couldn't handle his mother with Alzheimer's and he just checked out. Sad though.
Yeah. You're probably more patient than you realize.
My family and our friends aren't doing that, thank God.
Karen, did you want to add something?
Yeah, just I think Anita had, we've all been talking a little bit about, how anger can arise. My mom could be very angry, a very angry person, and she's trying to tell herself it's not his fault, it's not his fault. But I just wonder if my mother goes to anger because it's too hard to go to sadness and, put her hand on his shoulder and say the toast will come or whatever, yeah. The sadness is a, we're an emotional family. And I think that the sadness is something that she's avoiding.
Anger is often the visible emotion when we're feeling sad or hurt, because it's hard to say you hurt me. It's hard to say I'm sad and sit with those feelings. It's a lot easier to weaponize it as anger. And so yes, very possible. I don't know your mom, so I don't want to say concretely, but absolutely. Anger is the easy emotion to display. But my guess is your mom's really sad. Linda?
Pardon me. During COVID, of course, we've been socially isolated. And my husband's difficulties are largely verbal. I mean, apart from memory and, reasoning ability, but finding words and expressing himself are very difficult. And I've always been much more of a social person than he is. I have much more in the way of people needs. And one of my concerns going forward is how to have some kind of social life once it becomes possible again, right, to meet with people, when he so easily feels invisible. We went and had a deck visit with a couple of friends who are really more my friends, because I met them through community theater that I'm involved in or was involved in. I don't know if I'll be able to continue. And after the visit, he felt like that the husband had completely ignored him. The wife paid attention to him, but most of the conversation was really between me and them. And like how to find a way forward to have some kind of social life. I'm not a widow, but there's something akin to that happening. Yeah, so that's one of my worries, I guess, for the future.
I think it's okay to give the people a heads up. If these are your friends or your family and you're going over socially, similar to the card carrying, but more of a verbal call and saying, I'm coming with my husband. Here's my husband's experience. First of all, do you think that's something that you can manage? And here's what I would appreciate. Do you think maybe you could direct some conversation? You realize he might not be able to engage, and to set the stage. That's perfectly fine. And then part of your role may be to check in and sit next to him and say, oh, what do you think of that? And so to include him. On the other hand, it's also okay for you to do some social stuff alone. And so to find that balance between things that you include him with, and you absolutely should, and maybe just going out for a coffee with your best friend. While if he's okay to be at home alone, or while you have someone tag team in to just sit there for a bit, that's important too. But I absolutely recommend setting the stage. And that, choose your social interactions in that case, and have it be with people that can manage that, or people that genuinely care and they can handle that.
Okay, that's good. Thanks.
Anyone else have any questions, comments, challenges to throw at me?
Diane? You're on mute. There you go.
Hi. I'm going to ask a question for someone that I've been helping out. And her biggest issues is the guilt around placing her husband. She recently found out that the CLSC have decided that he needed a CHSLD level of care. And she was astounded that she couldn't have seen that herself, because she was so into looking after him. And now on top of it, he has been diagnosed with a cancer. So it's like one after another. So she's just very feeling guilty and sad and doesn't know what to do, what's the best thing. She would like to keep him at home and continue, but it's too much. He doesn't sleep at night. He's up and down. So I guess my question, what kind of reassurance or guidance can I give her with everything she's going to be living with soon, the fact that she's placed, and the fact that she can't manage it, and she's having a hard time accepting that.
So the first thing I would look at or maybe explore with her, because at the end of the day, the family member's biggest intent is to do everything they can so that their loved one is comfortable. And so it might just even be removing her from the equation and removing the placement from the equation, just saying, what does your husband need? What care does he need? Does he need 24-hour care? Does he need help with food? Does he need stimulation socially? Does he need any, and you kind of look at that globally. And wow,
Yeah.
all this would be really good for him.
Okay.
What? You can't give 5 out of these 8 things on the list, and maybe placement can. And so maybe you can meet those 5. Placing him can meet the other 5. And look, your husband's going to get everything that he needs.
Mm-hmm.
And what you'll take better care of yourself, and
Yeah.
you'll be able to, you know, and that health, that looking after yourself piece is really critical also. And so
Mhm.
sometimes it's just taking yourself out of the equation, because family members often fuse themselves and they can't even separate out. It just becomes one entity, and that's really tricky also. And so she needs to take herself out of that relationship and say, what does he need? And discuss that if you're the one who facilitates that, or have you just kind of look at it globally and say, okay,
Yeah.
I can't, but these ones I can do really well. This piece, not so much. And so what's the compromise? And
That's
so that
good.
sometimes can be very helpful. I often tell family members, particularly when I was in oncology, never promise that you can keep them at home until the end.
Okay.
Never promise that. Even though the patient might say, I want to die at home. And you say, I will do everything I can to make sure that happens.
Yeah.
The grief and disappointment attached to you breaking your promise, which sometimes you have to, is incredible. So never promise. Say you'll do the best that you can, and that if you need to, you will need to get help, because you love him so much and you want him to get the best care possible. And part of me showing you how much I love you is making sure you have everything you need.
Yeah. Very good. I appreciate hearing that. That's good. Like that. Very good. Thank you so much. I appreciate it.
Anybody else? Yeah, like,
I just make a comment.
of course.
What I have found incredibly helpful, especially as my dad's cognitive health has declined, is joining a support group. I applaud all you caregivers who have figured out Zoom, because I'm sure Zoom was your lifeline during COVID. Let it be your lifeline for your support group.
Thank you, Joy. And even individual therapy, if you're not someone who speaks in groups, to seek some kind of caregiver support can be very helpful as well.
I have a question. I don't know if you could answer this, Anita, but being a I missed the first few minutes. You're a psychologist?
I'm a psychotherapist and a nurse.
Okay, so before my husband and I, like I saw a few changes my husband, but I really thought it was retirement, depression, anxiety, and of course, you're almost hoping for that. I never even thought that it could be cognitive issues. And anyway, and I remember I went to see a psychologist myself and talked to her, and she pushed me. She said, don't, if you feel so strong about that, you need to accompany him to his doctor and, start, the process of talking with his GP. And that's what I did. And my kids were very involved as well. So that was good. But before I did that, I did do couple therapy with a psychotherapist, but he didn't even realize that there was more going on. He did ask a few questions. At that time I was probably quite agitated and mad at my husband, right? So anyways, but my husband had a really, really good rapport with the psychotherapist. So in talking with my GP, maybe a few months ago, he said it wouldn't be a bad idea if my husband wanted to see this psychotherapist. And I haven't done anything about it yet. And my husband said, oh yes, you really are. And I said to him, but if he doesn't know anything about dementia, he didn't even suspect either. And maybe, I don't know, 8 times that we saw him. So would that be something to explore? Or because somebody with frontal temporal who, like you say, it's the disease that making him squeeze, the disease, like, I don't know, the GP thought that it was more important, the rapport, than knowing everything about the disease, that he could find out what frontal temporal was. You could hand him over with your husband's permission, the report. I don't know. What do you say to me? Do you have an opinion about that?
What would the intent be? What do you hope would come out of him seeing a psychotherapist, and what does he hope?
Well, one, he was really good at boosting self-confidence. There was a lot I liked myself about this psychotherapist. So for my husband, I don't know, he's not one even before the disease who can talk about his emotions. So I don't know if it would help him. Like, is he aware of the disease? Is he not aware of the disease? And, you know, and I have to say, things come better, like, even like when we're getting my husband set up with any activities and stuff, we have my son do it, because there seems to be less like him and I, like, it's like she's telling me what to do, you know, and because I am doing so much more, you know, like it's, you know, it comes easier from my son. So I just thought, I don't know, would it be a good experience for him? Someone else to talk to, and would he share anything?
So I would suggest, if your husband says he wants it and that it would be beneficial, he's already made the decision.
Yes, he did, but now he has never brought it up since we talked about it in the doctor's office. It's gone right out of his head, unless I say to him, would you like to? And with this disease, I'm noticing something. Everything starts with no. Like, he'll say, no, I don't think I want to watch that right now. And then I say, okay, well, maybe I'll watch it. Before you know it, he is watching it and he wants to do it. And no, you know, like my daughter said to him yesterday, let's go for coffee now. She had driven him somewhere, and no, I just go home. But if she had just gone in there, and they would have had such a lovely time, just him and her. It's no right away, you know.
My suggestion is,
I'm sorry, I don't mean to cut you off.
Okay.
But we're at the end of time.
All right.
I think this would be a good thing to discuss in counseling.
Okay.
Kind of brings me to the
one
end.
quick
Sorry,
comment.
Anita.
Dean, call the psychotherapist. Call the psychotherapist, explain the situation. That's what I would.
Psychotherapist should tell you whether or not they feel qualified.
Yeah, I wasn't just going to appear there. Absolutely.
Okay.
Thank
Sorry,
you.
So that kind of brings me to sort of just my little recap at the end here. You know, if you don't already have a counselor at AGI, we strongly encourage that you give us a call for questions like Jean's and all kinds of other questions as well. So you can get a hold of us by phone, by email. Keep an eye out in your inbox over the coming days. We will send you a link to the recording of this lecture so that if you want to watch it again, you're welcome to do so. And there will also be in that email, there'll be a survey. So if you could take it just a couple of minutes, that's very short, and fill out the survey, it allows us to plan future lectures as well. I want to thank Anita and Anitra very much for their time. It was a very informative lecture. I think we all enjoyed it. So thank you so much.
My pleasure. Thank you, everyone, for being open,
Thank you.
sharing with us.
Thank you. Bye.